Good evening. This evening I'll be doing a presentation on shock. Now, shock is a life-threatening condition that occurs when there is inadequate perfusion of the cells of the body, meaning that there is an inadequate supply of oxygen and nutrient-rich blood to the cells of the body. Right? We're going to be discussing three types of shock. These are distributive shock, cardiogenic shock, and hypovolemic shock. Now, there are four types of shock that fall under distributive shock. These are septic shock, neurogenic shock, anaphylactic shock, and psychogenic shock. Now, in septic shock is caused by a severe infection, right? So, in septic shock, you have a buildup of toxins in the body. Now, these toxins causes the blood vessels to become permeable, meaning that they leak, right? It also causes vasodilation. Now, a person in septic shock, a person will be lethargic, they'll have a fever, they'll be tachycardic, and they'll also have dyspnea. Right? Now we're going to move on to anaphylactic shock. Right? So, anaphylactic shock is caused by a severe allergic reaction. Right? So, in anaphylactic shock, what you have happening is a similar situation where the blood vessels are permeable and you have widespread, or you have peripheral rather, vasodilation, right? So, a person in anaphylactic shock can present with many symptoms in the skin, respiratory system, and circulatory system. So, in the skin, you will see hives, edema, the patient will complain of itchy or burning skin. In the respiratory system, it can be wheezing because anaphylactic shock causes bronchoconstriction. You can also have stridor because it causes swelling of the upper airway and also swelling of the tongue. In the circulatory system, you have a low blood pressure, a weak pulse also. Right? Now we're going to move on to neurogenic shock. Neurogenic shock is as a result of the blood vessels, or rather, the muscles in the blood vessels losing their connection with the nervous system, right? Now that connection would normally cause them to constrict. So, with the absence of that connection, you have vasodilation, right? So, neurogenic shock can be caused by a brain condition, also pressure on the spinal cord, and also spina bifida, which is a birth defect which occurs when the spinal cord is not formed properly and is sometimes exposed, most times at the lower back. So a person in neurogenic shock will present with the absence of sweating below the injury site. Person will also be hypotensive and have red, flush warm skin below the injury site, right? Now we're going to move on to psychogenic shock. Now, psychogenic shock is a sudden nervous system response which causes temporary generalized vasodilation. Now, this sudden vasodilation will lead to fainting, right? So, in psychogenic shock, or rather, psychogenic shock could be life-threatening or non-life-threatening based on the cause, right? So, life-threatening causes of psychogenic shock are brain aneurysm as well as irregular heartbeat. And non-life-threatening causes of psychogenic shock are the receipt of bad news, and also unpleasant sights such as blood. A person in psychogenic shock will be diaphoretic, they'll have cool skin, and also be tachycardic. Right? We're going to move on to cardiogenic shock. So cardiogenic shock can be because of any of three reasons: tension pneumothorax, cardiac tamponade, and pulmonary embolism. Right, we are going to start off with the tension pneumothorax. So what happens in tension pneumothorax? You have a situation where air escapes from an injured lung into the pleural space. Right? Now that air is under pressure and it has nowhere to go, so it begins to compress the structures in the mediastinum, most times the heart and lungs. Now, this compression causes some clinical signs that the EMT is able to assess for. You will have jugular vein distension, tracheal deviation, as well as diminished or absent lung sound on one side. Right? Then move on to cardiac tamponade. Now, cardiac tamponade occurs when there is an accumulation of fluid or blood in the pericardial sac. Now, this accumulation of fluid causes what is called Beck's triad, which are three signs, which the EMT is able to assess. And these signs are muffled heart sounds, hypotension, as well as jugular vein distension. We're going to move on to pulmonary embolism. Now, pulmonary embolism is a clot in the pulmonary artery. Now, a patient with pulmonary embolism will present with shortness of breath, chest pain, as well as a cough which produces bloody sputum. Right? Now we're going to move on to hypovolemic shock. Now, hypovolemic shock is caused by an inadequate fluid or volume in the circulatory system. The cause of this can be hemorrhagic or non-hemorrhagic. So hemorrhagic causes of hypovolemic shock are severe burns, penetrating or blunt trauma, GI bleed or obstetrical bleed. And non-hemorrhagic causes of hypovolemic shock are severe diarrhea and vomiting. Now, a patient in hypovolemic shock, they will be restless, they will have poor skin turgor, they will be diaphoretic. Now, in the infant, you can look for hypovolemic shock in the infant by checking the fontanelles. The infant will have sunken fontanelles. Right? Now, there is one thing that is common across all the different causes of hypotension, of shock, and that is hypertension. It is a common factor across all types of hypertension, right? And that concludes my presentation on shock.